Hello, welcome back. Joining us this afternoon is Dr. Robin Rutherford. He is with Cosmetic Sedation and Implant Dentistry, and we appreciate you so much for being with us today.
Yeah, I always enjoy it.
It's fun having you on because we talk about different aspects of dentistry. Most of the time you think of maybe just going to get a cavity filled, but there's a lot more that goes into dentistry. And today we're continuing our talk on implants.
Okay. Last time I was here, Krista, we talked about how you can use dental implants to secure a loose lower denture, how you have the implants and then the little connections inside the denture to make it more secure, and denture wearers understand that. So today I wanted to give you a different aspect of implant dentistry, the way that you can replace a missing tooth with an implant. And if you can zoom in on this little diagram, it shows you, but always in the past, there's been two ways to replace a missing tooth. One is with a removable partial denture, and people know what that is. And the other way is with a permanent type bridge. Removable partial dentures are really pretty poor for a lot of reasons. But until we had implants, the best way used to be a permanent bridge. And what a permanent bridge is, it's the false tooth suspended between two teeth by attaching to those teeth, and the way it attaches is by crowning those teeth. Well, if you had teeth that needed crowning, if they needed crowning, then that would be okay. But to cut on two perfectly good teeth just to attach the one is really not good. The other thing is that food wants to get underneath the bridge, and in fact, just the very fact that the tooth is actually gone, your body allows the bone to start to resorb away. So it gets to be more and more of a gap. So that's where implants come in. If you have an implant, first of all, it's its own freestanding tooth, and so you do not attach to the teeth next door at all. So they're perfectly happy with the whole thing. And the other thing is, it's exactly like a real tooth. You have the implant taking the place, you might say, of the root of a tooth, and then the crown goes on top of the implant, and so an implant plus the crown equals a tooth.
So this is a great idea if you only have one bad tooth. You don't want to let the whole, the rotten apple spoil the bunch. And the same thing, you can just take care of the one rotten one, and there you go. Good smile. And
any place that you are missing a tooth, you can place implant, implant, implant.
And it's all pain-free.
Right. Yeah, it's very comfortable. I always call people the next day after I place implants and say, so how are you feeling? And they usually tell me, it's not even as sore as when they took out the tooth.
Great.
So that gives you an idea.
All right, sounds good. Dr. Rutherford, thank you so much. We appreciate you coming in today. It's always a pleasure, and wonderful to hear all of the wonderful things you can do with dentistry.
Right.
Thank you.